Welcome back, everybody. I'm sure you've heard these four letters said many times over your life, and maybe it's something that you're affected by. Maybe you know somebody, or you wonder about it. Might surprise you to realize that you probably potentially have suffered from it. I'm talking about PTSD. Now, a lot of times when we say those letters, we connected to the military and those who had served and what they went through, and they're still dealing with today. But PTSD comes in all different shapes and forms, and we're going to talk about all of that today and how you move your life past it when you're still afflicted by PTSD. She's an amazing psychologist, helps a lot of people with that and so much more, does individual counseling and also couples and more. And she's back with us. Dr. Ann Creekmore joins us here on the program. How are you doing today?
Good, Steve. How are you?
I'm very well, very well. I do want to share with everybody that this chapter on PTSD is also included in your book, Love Yourself, Love Your Life.
hmm
A lot of insight in there. Is it true that many of us, suffer from PTSD?
Yes, I mean, the technically PTSD has certain criteria to meet, and I can go over that.
Sure.
That is generally, according to the Diagnostic and Statistical Manual, mental disorders that that it involves having witnessed or experienced some kind of a life-threatening situation. And such that you develop symptoms, anxiety symptoms, if you will, to that experience. Like, certain things that trigger it. I can think of, for example, a woman who got a phone call, worked in customer service, helping. And a call helps with people calling for like certain funeral benefits and has to listen to people calling and they're upset about, getting something, a tragedy, their loss of a loved one. And then she got a call related to herself. And so that started to make her unable to work very well because because when she got the call that a coworker had passed on, that every time she gets the call from doing
Uh,
the job, she goes into panic disorder because there's the grief process, is kind of like holding in the grief in a boiling pot and the lid is shaking and, and then there's the
yep.
panic. So it's kind of like holding in a lot of grief, but the symptoms technically are avoidance, of a situation that reminds you of it, flashbacks to a situation like what I was just kind of talking about, having a flashback to that
Sure.
situation, panic attacks, vigilance, kind of being on edge and not wanting to experience that kind of thing and feeling kind of vigilant. And sometimes if it's something that has happened in any kind of public thing, it can be just wanting to avoid being in crowds, avoid being triggered, in other words. So those would be some of the symptoms, technically speaking. Mm-hmm.
So is it always PTSD? The criteria is it has to be connected to something that could trigger you to bring you potentially back to that feeling?
Yes, and
Okay.
usually consider something that you would feel relates to something life threatening. I mean, even like what we were talking about, where somebody had just had a heart attack and passed, and that kind of thing. It's something related to that, or someone could have been harmed, or you could have been harmed in the situation.
Well, you
And
said life threatening. Does it have to be
mhm.
necessarily a life threatening situation that caused the PTSD?
Well, technically, that's in the Diagnostic and Statistical Manual of Mental Disorders. That is what it's referring to. There are other, but that's just the type of PTSD that you get, like your house is burned down or something like that, or you're in the middle of an earthquake. Stuff that could really trigger. And but there is also complex PTSD, which is a little bit different than regular PTSD, which would be some of the childhood um, types when
Hmm.
there's a chronic kind of disruption in your life
Okay.
through abuse or neglect, severe neglect, even, because all of those to the child could easily be perceived as life threatening. You know what I mean? If you're in neglect to the point you don't have any food, on a chronic basis, that could feel life threatening, right? For example. But certainly, like abuses that can be very threatening, and that's
What
a different form of PTSD, complex PTSD.
what if you, as a child, experienced something like let's say a divorce, let's say a surprise divorce.
Right.
Just it
Yeah.
popped up out of nowhere.
Right.
You're a kid, you think everything is great. Next day, everything is not.
Right.
Um, or things like that, regardless of whether you're an adult now or let's say you're, 20 and that you experienced that when you were younger. It's not life threatening. It's life changing. Would
Mm-hmm.
that still come under the category of complex PTSD?
Well, it would certainly come under the category of complex PTSD, which is more the childhood PTSD. I mean, and any kind of, you know, shock kinds of things as a
Sure.
child that could, actually what it does, it causes a structural thing in the brain where you've affected your limbic system, your emotionality center, your reptilian brain, is it called, the old brain.
Sure.
When something really threatening, like I guess losing your parents could be perceived, certainly in a sense, or one's leaving, as kind of a life threatening thing because children depend on their parents. Then what can happen if you're have this kind of trauma occur, that it affects you to develop what's sometimes known as limbic ADHD, where you kind of go right into fight or flight so easily, perceive threat easily. You get a trigger to that, and all of a sudden you start exuding your adrenaline. Like we used to have that need for survival, being chased by a saber-toothed tiger or whatever, and you
Sure.
get an adrenaline rush and you can run away or fight or whatever you need to do. We don't need that now, but we can go into that. You get triggered, and all of a sudden it's triggering that flashback of that moment, and you're into fight or flight in a present day situation, which isn't so threatening, but you're perceiving it that way, and your brain is, and it's full of adrenaline. You're not thinking straight, and you're not being able to focus correctly.
What's the difference between, and now I see the correlation between and some of the examples that we're talking about that we might not think of it initially as life threatening, but to a child, yeah, it's life threatening.
Right,
Your
right,
parents are, your life has changed. That has threatened your life,
right,
especially, when you consider your parents your rock, safe,
right.
security, all that. What is the difference between, well, PTSD is post-traumatic stress disorder, right?
Disorder. Correct. Mm-hmm,
Okay.
mm-hmm.
We use the word traumatic. What's the difference between PTSD and experiencing a trauma in your life? The trauma could be the passing of a parent. And we've said before, uh, yeah, as children, we internalize these traumas and it affects us potentially later in life. What is the difference between a trauma like that and PTSD?
Right. And both would cause triggers, emotional triggers, where you get kind of, triggered to re experience it and bring it into the present. But like something like losing a parent would be like grief, would be a grief experience to work through, a mourning process. If, though, you have to think about, like, for example, I can think of someone who his father, when he was 7 years old, died of a heart attack suddenly, and that of course was grief, but on top of that, that put his mother into a complete depression, even feeling suicidal. They lost their income, they had to be moved place to place, so it led to a complex PTSD experience that he developed the complex PTSD, which is when the child is under age 8, they use a defense mechanism of dissociation, which is that, something's just so horrible. And this wasn't just the one experience of losing him and having grief like as an adult. It was the whole change of his whole environment, his life and his support and everything. Then if a child can't cope, they develop complex PTSD, which is really like sometimes the borderline personality disorder is the external picture of what it looks like eventually as an adult. But it's really kind of the dissociative identity disorder spectrum, where the person, if they're bright and creative enough, they can't manage. They're having, rather than have a nervous breakdown, the child mentally goes away and self-hypnotizes. And that's called dissociation. They kind of let another part of their brain handle this experience. The grief, like a helper part of the brain comes to be there and hold the grief and then put amnesia walls around it. And then, the child can come back out and go to school and play and kind of look normal, but it's already started a complex PTSD problem, which in my experience, just because I give the dissociative experiences scales a regular part of my intake when people come in just for their therapy session to get to know if they've had, especially if they've had, childhood traumas, that, close to 30% of the people that have major symptoms that they, don't really know what to make of that have bothered them. Maybe they've been called bipolar, or they've been called borderline personality disorder, which is a good description, externally of the behaviors. But I mean, they do kind of hear voices in their head, not schizophrenic, chemical imbalance, but they're kind of in different modes, because once the child learns to dissociate, every time there's a stressor, then they, develop another part of them. They go away mentally, know how to kind of go away. Is it stressful? Mentally go away and let another part of my brain starts to hold those memories and becomes expert in that area. And it could happen from anything, like Herschel Walker. You know who Herschel Walker
is? Yeah, football player, sure.
Right. He was a major, Dallas Cowboys, Super Bowl quarterback. He got the Heisman Trophy. Now he's a politician, right? And he wrote a book about this, about the complex PTSD, because he has it. After his book is called Breaking Free. It's a good book, and it's written with his therapist, because after football was over, he started playing Russian. He started playing Russian roulette in his closet, and he was like, "Oh my gosh, I'm going to kill myself. What is going on?" So he went to therapy. Right, a crisis usually brings people to therapy. So he wanted help, and he found out that he was actually on the DID spectrum, the dissociative identity disorder spectrum, or complex PTSD, as it's kind of euphemistically called, I would call it in a sense, or it's a good description though. And he found out that he had developed this part that are, a mode alter, if you will, that depending on the level of co-consciousness, that didn't have anything to do after football was over. So kind of saw a gun in the house. No, this will be good. I need something. My job, they come for different purposes. My job is to take on adrenaline, dangerous activities. This sounds like a good one, but he's in the closet playing Russian roulette, and it was a compulsion. He wanted to stop. So when he went to therapy, he found out that that part of him, the football guy, was doing it. And then, of course, once he knew and could let walls down and do the therapy, they could communicate, say, no, wait a minute, we'll find you something else to do. We don't want to die because we'll all die. Let's explain it. Because the parts often do their own thing without really the memos getting passed or even the whole big picture happening. So, and I'm getting to a point on it as far as trauma. He believed, and of course, when the book was written, it was in the middle of his therapy, but he believed that bullying, chronic kind of bullying at school, is what had caused him to dissociate and develop the complex PTSD. It's kind of, and that can be perceived, let's face it, when I'm thinking about it now. I mean, if you're bullied, you might think you could get killed. Why wouldn't you? These people aren't being nice to you and they're pushing you down. or whatever they're doing. I don't know, and I don't know about him personally, but I'm just giving examples. It could feel life threatening to a child to feel bullied. And so anyway, he developed that, and then but he wrote the book for the to help people to raise consciousness, like, because here's this great athlete, and he's doing great. So people can go around and be directors and doctors and great athletes and have complex PTSD with different modes and different alters depending on the level of co-consciousness. Not everybody has to be the 1 in 100 that we think of as multiple personality disorder, or that we think of in the DSM, the Diagnostic Statistical Manual, as dissociative identity disorder. But even still, when you talk to them, they may not have full-blown alters with blackouts, amnesia between, but they go into these different modes of themselves at a lower level with higher co-consciousness between modes. And he wrote it to show people that, a lot of people have this, and it's not, a terrible thing, especially once you got it and you can work on it in therapy and pull, raise everybody up to a higher level and even integrate if you decided you wanted to do that. Vulcan mind meld Spock thing, there are therapeutic ways to bring them all together eventually.
So I want his disorder came from being bullied in school.
That was, I think so, yes, because I think he felt he had a healthy family life, and that was my impression from the book Breaking Free, that
Yeah.
his at that point. But of course, remember, when you dissociate, the whole point is for you not to have to think of or know even about the traumas. And so until you get into therapy and you find out you have this, you got a lot of amnesia. So I don't know toward the end of it if there was something else that had happened that he discovered through the course of his therapy, but that's basically what I think they thought at that point. It was just from the bullying at school.
Wow. In the book, I'm seeing,
Mhm.
I looked it up, that he wrote that he had a dozen distinct identities
Absolutely,
or
yes.
alter egos.
Right.
And when that happens, I have to assume that you don't know what's happening. Like he says in the book that many of those identities did good things, but the ones that did the bad things or attempted to do the bad things were
Right.
pretty bad. Like you said, the
Right.
Russian roulette.
Right, exactly. Because each part comes for a different job to handle it right at that moment. And of course, as you get to be a teenager, at least, or before, you have to
Right.
develop a stand up part. That's just about being you have a teenage rebellious part, that's there individuating, but doesn't grow up, and is still doing that. Or a part that's, I call it the Terminator, like from Arnold Schwarzenegger, the Terminator, the protector part that's there to stand up for you, for the host, because we all have to stand up for ourselves. But, when that part comes out, its total job is to put down the enemy, which could be your wife or your child or your employee or
Right.
whatever it is. And that part, is just going to smear the enemy kind of thing. And that part, can be kind of selfish, narcissistic, because that's its job to help. It's like the horses running down the racetrack with their blinders on. They have their job and they're very effective because they're triggered to come out of that certain stressor that they see in the outside environment, and they do their job expertly.
Hmm.
And so that can be a difficulty. Like there was a good movie. It's called The 21 Faces of Billy Mulligan, I believe it was. It's a documentary about this person who they would have labeled like an antisocial personality disorder in terms of the big description, personality disorder, which is fine. But it turned out that he had 21 alters that he would switch into. And of course, he's being interviewed in prison because of the things that like 2 or 3 of his alters would do. But yet he at the same time was this very nice, great life manager, good person, artist, all kinds of other things. And I could be really wrong, so don't quote me in this, but it's a great documentary to watch. But I have a feeling that he has had contact with some older siblings or cousins or something that did antisocial things. And what happens is that that person, when they're in a stressful situation, the child develops a part to handle it, to be the buddy. So in that case, he's got these people and trying to engage him into some antisocial activity. Well, that could be considered stressful, right? So what do they know to do? Well, I dissociate. This is very stressful. Let me mentally escape, self-hypnotize. And put then another part of my brain is activated to become the antisocial person to do those kind of things with them, to get along. Little buddy.
Now, you said before, um, people, I think it was in a reference to children, can self-hypnotize themselves
Mm-hmm.
to take themselves out of a situation or feel the potential pain from a trigger. Can anybody do that? And do we know that we're doing it? Or is it just I've even heard it something described as, I feel like I'm living a dream.
Yes,
Is
that's
that,
one of the symptoms. You see, there's in the dissociative experience scale where you're asking the person all these symptoms to rate themselves in a daily life, how often they feel they're in a dream, how much amnesia they experience, how often do they hear inner chatter, from different voices, how often can they see themselves as if they're looking at another person, like they've gone back and another part of them has come out to the front and is active, and they're observing themselves do something. How often do any of these things happen? That gives you a good indication if they've had that dissociative disorder on the spectrum.
hmm.
And did I answer your question? No, I'm sorry.
Yeah, yeah. I didn't know it was possible to self-hypnotize ourselves, but it's probably we're given that skill
Yes, right. Because
to
children have a
escape.
lot of imagination, right? They have imagination.
Wow.
They can make believe anything. If they're riding a pony, they're riding a pony, right? If it's a broom, but it's a pony.
True.
And so they can do that at under age 8. If you've got the traumas, occurring, then they may cope with it by just, it's called going away. They just know to go away and just let another part of the brain at work, and then they can switch out and come back, and then they have that started a process of the complex PTSD.
Got about a minute or so left. I want to share this in your book, and it's an acronym, um, and it's to reverse PTSD.
Right.
And the P is pause.
Mm-hmm.
The T is translate in your head. The S is state the opposite and reveal the truth. And the D is detach.
Correct. and
Interesting.
and that would be a good talk for us maybe next time, because what that refers to actually is when you're talking to someone that's narcissistic and may cause you to develop PTSD. That's why I used it.
Mm.
Then that is a way to reverse it and to talk to them in a language. So it's another whole topic we could talk about. But I kind of used it because you get PTSD when somebody's not caring about you and is bullying you or
Sure.
mistreating you in some fashion. It's
Sure. I've learned this, and I've actually shared it with somebody the other day that was going through something. Um, it's kind of the same thing as the acronym there that you have for PTSD, but it's three things that you can repeat to yourself. I am not my emotions.
mm,
I am not my thoughts. I am safe in this moment.
absolutely peace. Yeah,
Yeah. Yeah.
absolutely. That's perfect.
Because yeah, well, a lot of times our minds just go, full of crazy, just thinking of things and
Absolutely.
so if you say you're not your emotions, that's not me, but my emotions are getting the best of me. I'm not my thoughts because it's going all over. And what do we want to be? Safe right now in this
Absolutely.
moment.
And the
Mm.
DBT, dialectical behavior therapy, mindfulness therapy, is something for quote borderline personality disorder, which is a description of the complex PTSD. it teaches you that as well. But I love your mantra, just to take it, post it everywhere,
Yeah.
and be at that place, and to bring everybody, whether there's one mind or many inner minds, in our family system, to that point that it's all okay. Good
Yeah.
job.
It
Yeah.
just kind of centers you.
Yeah.
And if somebody is going through some challenges, or they're interested in taking a look at your book under your pen name, AP Filosa, how do we find you?
Yes, I think the easiest way is just to go to Psychology Today online, and you can look me up, Anne Creekmore, on it. And there's my link right to my website for my clinical practice as a licensed clinical psychologist, and my books and CDs, because I do the hypnosis CDs and MP3s for what you're talking about, for anxiety, and to bring it back to the level of peace.
Always great talking with you. Learn so much, and looking forward next time we get together.
Me too, Steve. Thanks for everything.
Thank you. We'll be right back.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.